putting this in more general terms again, not a specific trial, but in general, we all know that self-reported outcomes, pain in particular, is more susceptible to context or placebo effects compared to objective outcomes. And we sometimes also use objective outcomes in these trials. It's not only self-reported pain, but it also different measures of muscle strength, for example. So I wonder if there's anyone in the panel who would like to comment on this, and if we see the same improvements in muscle or more objective measures as we do in the self-reported measures, or what is your opinion about this? Anyone in the panel who would like to comment?
Can I jump in real quick on this? We have some really, really good data that we've published on patients before and after total knee arthroplasty. And we have patient self-report on instruments that have IRT analysis done on them, so you can look at each of the questions. And then we have, so for example, there are questions about how are you doing going up and down stairs, walking, swelling, pain, strength, range of motion. We ask them those questions pre-op, and we measure all of those things, including with 6-minute walks and stair climbing and all of those things. And then we see them their first, 4 weeks after the total knee. And in every single case, their actual performance is worse. Their range of motion is down, their strength is down significantly. They have more swelling, they walk slower, they are worse on a tug, they're worse going up and down stairs. In every case except the swelling question, which is they're looking at it, they say they're better. And they're not. They are significantly worse, but they say they're better. And our assumption about that is pain trumps everything. And so if their pain's better, they say they're better on all these things. And objectively, they are incredibly worse.
Or could it be the fact that they've had a very expensive intervention?
No, it could be, but it also could be that their pain's better. They're 4 weeks after their total knee, they're 4 to 6 weeks, they're better. Their pain is gone. And that's but I mean, David, you guys have spent a ton of time studying like residual pain issues, but also the function. So patient satisfaction and happiness as measured on a lot of these patient-reported outcome measures does not necessarily translate to their function or how they're going to continue to function. I mean, part of the reason that we see that patients, pre and post-op total knee is their function a year later is about what it was pre-op, but they don't have pain, right? Is that okay? I don't know. Again, if happiness is the key, then fine. But I would like their physical performance, their functional performance measures to be better.